Well, I'm presenting the case study 83, malignant melanoma. The disorder is malignant melanoma. My name is Paulson Elekuru. Patient case introduction. The chief complaint, patient reported a social dark brown mole in his scalp. The history of present illness. R is a 38-year-old white male who presented to his primary care provider because his wife found a suspicious dark brown mole in his scalp while doing his haircut. He was therefore referred to a dermatologist. uh, Description and epidemiology of malignant melanoma. In the United States, of all cancer, whether skin cancer or otherwise, malignant melanoma is the most common of all cancer. Although malignant melanoma represents only approximately 1% of skin cancers, but it accounts for most death from skin cancer. Uh, Projected incidence. There's a projection of approximately 100,064 per year. There are cases, which is approximately 58%, 58.8% in men and 41.2% in women. Projected mortalities are approximately 8,290 people will die from melanoma, which is about 65.5% men and 34.5% in women, because also is more common in men than in women. The prevalence it varies by age and sex. Like I said earlier, it's more common in men than in women and in older people than in young people. Notwithstanding, it occurs in young people. Individuals younger than 50, there has been no changes in women, and there is a decrease of 1% a year in men since early 2000s. In people 50 years and older and above, uh, there's a 3% per year increase in women, but no changes in men. Mortality rate decreased rapidly from year 2013 to year 2017, which is mainly related to advances in treatment or advances in technology of treatment. uh, Approximately 6% to 7% per year since year 2017. So there have been approximately 6 to 7% decrease because of advances in treatment. Major risk factor is people that are fair in complexion with lifetime risks of 1 in 3 for whites, 0.5% or 1 in 200 for Hispanics, and 0.1% or 1 in 1,000 for blacks. Increasing risks uh, is age, with average age of incidence of 66 years. And also there is an increase with people that are exposed to sun and radiation, people that are exposed to chemicals and heavy metals, including herbicide and insecticide. However, it is one of the most common cancers in young adults too, especially young women. According to American Cancer Society 2023 and Strasilov and Yudanov 2021. Pathophysiology of malignant melanoma at the cellular level. The melanocytes, they have unique characteristics of synthesizing melanin, which also has a complex antioxidants and pro-oxidant property. The transformation of these antioxidant form to a pro-oxidant form under the control of various etiological agents, which include ultraviolet radiation, heavy metals, herbicide, is the critical pathogenetic origin of carcinogenesis. That's why it originates from mutation of genes uh, through uh, biological or chemical agent or physical agent like radiation, UV radiation. Melanin's pro-oxidant action leads to the elevation of levels of intracellular oxygen radicals, therefore orchestrating DNA molecule damage of the melanocyte. Overall, these mutations occur due to related to excessive activation of diverse cell signaling pathways from neuroblastoma reticular activating system NRAS to mitogen activated protein kinase MAPK, which in turn leads to the uninhibited or uncontrolled proliferation, the differentiation, immortalization of definite cell types or specific cell types. That is, after the mutation and the proliferation, these cells they become immortal or unable to die. Um, from NRAS, B, RAF, and MEG to MAPK. That is the pathway. Clinical manifestation, uh, subjective data. The past medical history, 10 years ago, the patient has a lipoma, which was surgically removed over his left chest rib cage with no resurface or relapse. 8 years ago, he had episode of major depression with suicide ideation, which was successfully treated with psychotherapy and antidepressant for 10 weeks with no relapse. He had a 4-year chronic seasonal allergic rhinitis. Family history. The 58-year-old mother has hypertension. His 64-year-old father has COPD. They are both alive. 5 years old brother seemingly in sound health. There's no family history of familiar atypical multiple mole syndrome or cancer. Social history. On weekends, he drinks 6 pack of beer. During the week, 2 bottles of beers every night. He denied use of tobacco and intravenous drug abuse. He's been married for 14 years. His second marriage has been going on well. Uh, is an 11-year-old engineer with Union Pacific Railroad. Uh, he has multiple blistering sunburns during his childhood. He goes to a gym to work out twice per week using weights and treadmill. Medications. He uses OTC in April and September, or OTC antihistamine for seasonal allergic rhinitis in April to September. Allergies includes aspirin. It causes hive and wheezing, and also is allergic to cats. It causes wheezing, watery eyes, and runny nose. Pertinence objective data. General appearance, healthy looking white male in no apparent distress. He has a red hair, green eyes, pleasant, alert, engaging, but anxious. Constitutional, no fatigue, weakness, headaches, cough, fever, chills, night sweat, nausea, or vomiting. It denies changes in vision, smell, hearing, or bowel or bladder habit. Vital sign is within normal limit as shown on the screen. Our physical his height is 5'9", his weight is 175 pounds. Physical examination review of systems. Musculoskeletal, the skin has is slightly diaphoretic and is warm to touch. Body hair is normal distribution, but there is scattered nephi on the back. Also, there are multiple scattered nephi on the back, but no rashes or lesions. Next, so lymph node. There is bilateral 2 centimeter cervical lymphadenopathy, but no thyroid megaly, no jugular venous distension or carotid root. HEENT within normal limit except for 7 millimeter dark brown nodule on the scalp above right ear that was found by the wife and reported by the patient. There is a uh, dome shaped, symmetric. It also has prodentation with several fractured teeth. Chest, lung, and respiratory within normal limit, except there is a well healed surgical incision on left anterior chest wall, due to related to past medical history. The cardiovascular neuropulse, the ROM, the joint on the lower extremity and upper extremity, the GIG, they are within normal limit. Biopsy, mole excision consistent with nodular melanoma cells that was found in during biopsy. The tumor thickness is 3.8 millimeters, and there is enlarged cervical node measure 2.3 between 2.3 and 2.7 centimeters. CT scan, the thorax is negative except suspicious shadows in the liver. Abdomen is negative. The brain CT scan is positive for three lesions. Diagnostic and laboratory blood test results they are shown with few abnormalities. The role of the advanced practice nurse, underpinned by the Christian worldview, the APRN demonstrates skills and knowledge in the management of malignant melanoma as follows. One, the APN shows competency in screening through exhibiting proficiency in skin assessment, triaging, and risk assessment for early skin cancer detection because it can be so highly metastatic and it can lead to death if it's not detected early. Number two, the APM provides education by encouraging patients to maintain healthy lifestyle. Like this patient drinks a lot during the uh, week weekdays and weekend. Number two, number three, the API assists the general practitioners and dermatologists in diagnosis and treatment by providing by showing proficiency in knowledge and screening skills. The APN helps in design interventions that can decrease morbidity and mortality related to malignant melanoma because it causes most death due to skin cancer. The APN serve as a primary care provider with the use of digital technology and collaborate with the interdisciplinary team to care uh, to provide care for people that live in underserved community such as rural area and minority communities. It can be through telehealth to provide services for those people that are less privileged uh, as a primary care provider. Numbers. Slide 7 is questions. Number one, are there any abnormal laboratory blood test results and of what significance, if any? Number two, what subtype of melanoma is apparent based on the otherwise limited information? Number three, what's the 10-year prognosis for this patient? On the last slide is references. Thank you.